According to the Centers for Disease Control, data shows America is in a mental health crisis, especially for our young people.
And medical professionals are very concerned about a lack of resources. CBS 17 investigative reporter Mary Smith shares just how bad this problem is and what experts are doing to change it.
The CDC says that suicide is a leading cause of death. And according to information from 2023, this accounts for one death every 11 minutes. That's one person who has passed away since you at home started watching this newscast. It's one of the reasons why mental health professionals say access to care is so important.
Amy Brundle likes to spend her free time traveling with her husband. She's a marketing and communications professional with NAMI, North Carolina. The organization offers mental health help to people for free.
There are definitely down days, but I feel like I've kind of established this foundation for a much healthier and more engaged life day to day.
Those down days, she says, started as a kid.
I probably had symptoms of mental illness starting in early adolescence, but at the time, growing up in the 90s, this was not something that we talked about.
Brundle says things changed when she was in a car accident in 2006. After that, she was treated for post-traumatic stress disorder. During treatment, she says her provider told her that her symptoms she dealt with as a child were possibly signs of anxiety and depressive disorder.
So I began being treated for all of that. And while the treatment significantly helped, I don't have many of the symptoms of PTSD any longer.
Brundle certainly isn't alone in her experiences. The Centers for Disease Control says data shows America is in a mental health crisis.
The demand for resources around mental health increases every year.
It's a demand that's reflected in data from the 988 Lifeline, which connects anyone needing help with someone offering support. Since its launch in July 2022, as of July 2025, there have been more than 16 million calls, texts, or chats nationwide. Data also shows a steady increase in people reaching out year to year. The data is from the Substance Abuse and Mental Health Services Administration, also known as SAMHSA, which primarily runs the Lifeline. SAMHSA saw cuts to its staffing earlier this year and faces possible funding cuts in 2026. The executive director of NAMI North Carolina says they get funding from different sources.
That funding originates at the federal level. So in North Carolina, we're sending tax dollars up to the federal government, and then some of those tax dollars come back to us through a variety of programs. So anytime that you have major shifts in those funding priorities, they are going to have a state and a local impact.
CBS 17 Investigates asked NAMI North Carolina what resources North Carolina needs.
It's kind of on a continuum in terms of what we need. So inpatient treatment, that is always, almost always an under-resourced area, that more people need beds than what are currently available. And that has such a negative impact. So there are new beds coming online, which is great. But there's also the fact that a large number of counties in North Carolina do not have a psychiatrist available.
According to Rural Health Information Hub, citing data from Health Resources and Services Administration in July, most counties in North Carolina were considered a mental health professional shortage area. And according to information published by the American Academy of Child and Adolescent Psychiatry, citing data from the Health Resources and Services Administration from March 2025, 72% of counties in the U.S. do not have a practicing child and adolescent psychiatrist. In North Carolina, it's 57% of counties. And help for children is needed, according to Sharon Bell with the North Carolina Department of Health and Human Services.
There has been a growing rate of the number of children, both in middle school and high school, that are indicating feeling sad or hopeless for 2 or more weeks, which is quite concerning.
NAMI NC wants people to know about the resources that are available.
The easiest way is to pick up the phone, call 988.
The mental health landscape can be really daunting to try to figure out yourself, especially if you're just getting started with your recovery journey.
And we do have a list of resources for help and a statement from SAMHSA at CBS17.com. Mary Smith, CBS 17 Investigates.
Mary, thank you. And a very important resource. Remember, if you or someone you know is struggling, call or text 988 to be connected with someone who can help you.